My name's Tristan McMullen. I'm an eyelid surgeon, an ophthalmologist who specialises in surgery around the eyes. And I've been asked to talk today about some of the complications that can arise from having surgery to your eyelids. I think it's important that patients do realise that there are potentially serious problems that can relate to eyelid surgery. But fortunately, these are very rare, and with the right kind of preparation, one seeks to minimise these risks altogether. I tell patients that one of the complications they're going to get is bruising, and I tell them this is almost guaranteed. To a certain extent, they can moderate the amount of bruising that they get by their post-operative care, and that's the subject of another video. So bruising is a given. Infection is very, very unlikely in surgery around the eyelid, but it's always possible when we seek to minimise this by proper surgical technique. I don't personally give oral antibiotics after surgery, but I do ask patients to apply antibiotic cream. The incision site does take a while to heal, and stitches are normally removed at about 5 to 10 days. And the incision goes through a process of healing and can look a little bit red for a while, but then goes white and then eventually fades away. And so a scar, which was a word we try not to use, is visible for a while, but usually that heals up with no visible trace. The most dreaded complication from eyelid surgery is loss of vision, and that would be caused by a hemorrhage behind the eye, a so-called retrobulbar hemorrhage. Fortunately, these are exceedingly rare, but they have been described. Part of my post-operative regime involves having patients avoid heavy lifting or bending so that they keep their head above their heart. And I perhaps overplay this a bit, but I'm absolutely determined that I should never encounter this. And these are some of the things that can be done to avoid it, but that is a devastating complication that can result in either partial or total loss of vision in the eye that's operated on. It's of the order about 1 in 10,000. So it is rare, but it does exist. The most easily avoided complication that unfortunately is sometimes encountered is when patients have too much eyelid skin removed. Patients often come in seeking the removal of excess eyelid skin. And if you take too much skin from the upper eyelid, then patients find that they can't close their eyes, which gives them chronically uncomfortable eyes. And this is something that needs to be discussed very carefully with patients, particularly in the cosmetic setting where they're paying money for effectively skin removal. And to some extent, there's an expectation that the more skin you remove, the more value you're getting for your money. But you can take this to a certain point, and once you push it further than that, you get the law of diminishing returns and unhappy patients. And similarly in the lower lid, if you end up taking too much skin, you get lower lid retraction, and you start to see the white of the eye below the coloured part of the eye, and that's an abnormal appearance that one should seek to avoid. So those are two things that obviously relate to surgical technique, but would come down to complications if they were to happen. I always advise patients that they will get a dry eye after surgery, particularly to the upper lids, surgery to the upper lids. And this lasts about 6 to 8 weeks, and I have them use eye drops to alleviate this. And it's usually a temporary phenomenon. I tend to be cautious with patients that have had laser eye surgery, either LASIK or LASEK, because this often gives them pre-existing dry eye, which can then be worsened. So I'd be very cautious in my skin removal in these patients. I would counsel them accordingly. Other than that, I mean, anything can happen in surgery, but those are the sort of common things that I'd like to run over with patients before surgery and make sure that they fully understand that they are embarking on a procedure that unfortunately does ultimately, in the worst case scenario, have a very, very serious consequence, i.e. loss of vision. Fortunately, we know what we're doing, and these complications are rare, but it would be a fallacy to pretend that they don't exist. Thank you.